So hello my dear friends, welcome back to Hoxmo YouTube channel once again. So today's topic is test diet or dietary approaches to stop hypertension. Previously I have discussed, if you see the previous video, uh, one of the biggest dietary controversy which is present online. So today we are going to talk specifically on hypertension and what should be the ideal diet if you are suffering from hypertension. So before discussing this topic, what do you mean by hypertension? Hypertension means hyper means more and tension means pressure. Tension does not mean your mental tension or stress. It does not mean stress. Tension means pressure. That means your blood pressure. So hyper means more. So there is more pressure. How much pressure? According to American Heart Association, if your systolic blood pressure is more than 130 millimeter mercury, or your diastolic blood pressure more than 80 millimeter mercury, then you are suffering from hypertension. This is the latest guideline of American Heart Association 2017 guidelines. And what do you mean by normal pressure? What is elevated? What is stage 1, stage 2 hypertension? These details will be discussed in another video. Otherwise, this video will be long. So now the topic is diet for this hypertension. What should be the optimal diet? So as per the American Heart Association, the test diet or the optimal diet, which stands for dietary approaches to stop hypertension, is basically to consume a lot of fruits and vegetables, whatever I have mentioned in previous video as well. So a lot of fruits and vegetables is important, and low fat dairy product. If you are taking dairy product, then you should take low fat or fat free dairy product, what we have mentioned in previous video. Basically you can take skimmed milk, so that you should discard fat, or if you take milk in your home, then also you can skim off the fat part, and then you can consume the milk. And I have also mentioned in previous video that huge amount of people cannot digest milk properly because of lactase deficiency, and it is also known as lactose intolerance. And if you can digest, then you should use skimmed milk. This is one aspect. And another important topic is saturated fat. So whatever the saturated fat we are getting from red meat, from any other milk portion, if you are not discarding the fat portion, then you are getting saturated fat, and these saturated fats are extremely bad for your hypertension point of concern. And I am telling you that if I consider one of the most important dietary advice, and this is to avoid butter consumption or ghee consumption. If you are consuming ghee or butter, then discarding ghee or butter is the most important dietary advice what I want to give you. So you can discard this butter or ghee counterpart from your diet. And whatever we have discussed, a lot of fruits and vegetables along with some protein intake is extremely important. So as per your body weight, 0.8 gram per kg per day. If you have 50 kg body weight, then 0.8 multiplied by 50, whatever you get, you can consume per day. And not exact measurement is not required. So exact measurement is not required. You can just have a little bit idea. And I will just discuss this topic separately in another video. Now another important point is restriction of salt intake. A little amount of salt, which should be less than 6 gram of salt per day. That means a small teaspoon of salt, less than a small teaspoon of salt is extremely important, including your cooking salt. Some people tell in our area also, locality also, some people tell that I don't take salt from outside, I don't take salt when I eat, I only give salt during cooking, and this is okay. And I am telling you, my dear friends, this is not okay, because your raw salt, whatever we are taking during your eating, your raw salt and the salt whatever we are using for cooking is extremely same. Before cooking and after cooking, it is actually same. It is sodium chloride. So sodium NaCl Before cooking also it is sodium chloride, after cooking also it is sodium chloride. So it does not make any difference if you are telling that it is acceptable to consume cooked salt. I am telling you it is not acceptable. So including your cooking, a total salt intake should be less than 6 gram per day. And if you consider elemental sodium, the guideline is less than 2300 milligram of elemental sodium per day. So this is all about guideline regarding hypertension and what should be the ideal diet. And I am telling you to subscribe this channel. It is very important. You are seeing video but not subscribing because this is a trusted source of information from registered medical practitioners. If you are going to any doctor's chamber, you will not get every information because there is not no time to give detailed information what I have given you. And I am just, because this is my job to give all this information from our textbook as per Harrison's principle of internal medicine and any other textbook, as per American Heart Association guideline, any other guideline, comparing all these guideline textbook information, then I will make video, you will get this information. So subscribe this channel. If you go to doctor's clinic, they will write medication in under 5 minutes. Oftentimes you will not understand handwriting also. So subscribe this channel, very much important. Thank you for watching this video.